Hi everyone. So we are with Mountain Laurel Physical Therapy. So we are in the Des Moines metro area wanting to highlight other medical providers and trainers and healthcare practitioners in the Des Moines area. So today we have Catherine with Hatch Physical Therapy, and she is women's health and pediatric physical therapist. And so, yeah, we're super thankful that she's on the show so that we can just learn a little bit about her and tell us about herself. So I'll kind of give it to you, Catherine. Give us a little background about you and Hatch and how everything has gotten started with that business.
Yeah, thanks so much for having me. So my name's Catherine. I'm a physical therapist coming up on almost 10 years this year, which I can't even believe it. And my business, Hatch Physical Therapy, is about a year and a half old. So I can give you a little bit of background about kind of how I got into physical therapy and then maybe what led me into starting my own practice. So yeah, I always knew that I wanted to do something in the medical field. I went to Luther College and I did a little bit of music and I did a little bit of science and then ultimately did some job shadowing and specifically in a pediatric clinic up in Decorah that did a lot of intensive work with kids who had special needs and neurological, like neuromuscular disorders. And was just super inspired at what a physical therapist can do to help these kiddos. And so that led me to pursue a physical therapy degree. I went to the University of Iowa in Iowa City and did my PT training there, and then ultimately ended up in Des Moines, working a couple of part-time jobs back in it would have been 2015. The physical therapy market was pretty saturated at the time, and specifically for pediatric positions. So I kind of just took what I could and that was available in the Des Moines area. And so I did some PRN and part-time work in pediatric clinics. And then I also worked in an outpatient clinic where I actually developed sort of a pediatric clinic within that space. So kind of within your traditional outpatient clinic. And over the years, just really became passionate about working with kids. So by trade, pediatrics is my main background. I worked kind of all over the spectrum, like babies, older kiddos with orthopedic concerns. Like anytime a child came through the clinic, I was kind of the therapist that would treat that. And then, yeah, a couple years went by and just practicing more like general pediatrics, general orthopedics. But then an opportunity came about that was related to pediatric pelvic floor therapy. And so that's kind of a trending topic, the pelvic floor. And when we think about that, we think mainly women's health. But there was a huge need at the time for pediatric pelvic health. So kids struggling with urinary incontinence, bedwetting, UTIs, maybe a child had chronic kidney condition. Constipation is a huge one in kids. And so I kind of jumped at that opportunity and became one of the very few therapists in the Des Moines area treating kids with pelvic health issues. So just became very passionate in that space too. And then I had my own kids. So I now have two boys. One's almost 5 and one is 2.5. And kind of going through that pregnancy and postpartum period and becoming a mom myself and kind of living some of those challenges, like with pelvic floor, with breastfeeding concerns. My son, both my kids had tongue ties, and it just opened this whole door of an idea of what could be possible, kind of branching out and becoming a really niche practice. So no longer being the therapist that could just see any child that walked through the door, but being somebody that families could come to that was more of an expert in pelvic health and infant development, and then kind of tying in women's health too. So after going through all of those things myself, I did become trained to be a women's health pelvic floor therapist too. So while my background was in pediatrics, now I'm a full fully well-rounded public health therapist treating children as well as women in the pregnancy and postpartum periods. So that those ideas all just kind of spiraled, and that is the mission behind Hatch, was to be a therapist that could really encompass sort of that full circle of motherhood, infants, pregnancy, postpartum, and then that full circle pelvic health therapist too. So treating people kind of through the lifespan, because a lot of times pelvic health issues are starting in childhood and then they just persist if we don't intervene. So that's kind of the background behind Hatch. I guess I don't know if you had any like follow-up questions in between there, but
No, thanks so much for sharing all of that. It definitely, it sounds like this is why you're on the podcast, is because we don't do anything at Mountain Laurel related to pelvic floor with kids or postpartum breastfeeding moms. We do a little bit, but we like to just save it for the people who that's what they are super passionate about and that's what they love doing. And so what do you think, what at this point, what are your favorite things to be treating? Like if you had an ideal client, who would that be?
yeah, so I guess like pelvic health is one part of my practice, but the other side of my practice really is infant therapy. And I kind of mentioned I went through my own breastfeeding concerns with tongue tie with my kiddos. And back then, 5 years ago, tongue tie was kind of starting to become more known on what to do about it. But at the time, I just really couldn't get a straightforward answer. We sought out a couple different specialists, and it was just this wishy-washy. We could release it, we could not. It could help, it could not. But then that really inspired me to kind of dig deeper into the therapy side of what you can do for oral ties. And so that's a big part of my practice with Hatch is helping families navigate that decision. So tongue tie, lip and buckle ties is a big part of my practice, and helping navigate those early infant feeding stages through breastfeeding or bottle feeding. So I work very closely with dentists in Des Moines and lactation consultants. So just kind of trying to fill that gap of what I missed out on, where we can really collaborate. It was kind of like one provider had one opinion, another provider had a different opinion, but how can we actually communicate together to make a decision in how to address tongue tie? So that I've become very passionate about helping families through that. And I have so many parents that just are like, oh my gosh, thank you so much for this information. We've never heard this before. And sometimes doing the therapy side of things, you might be able to avoid a release procedure, and other times it is indicated. But yeah, I would say the infant therapy world is kind of what I'm most passionate about at this point. So
So it
yeah.
sounds like these moms are going to a lot of different providers before they find something that's helpful. Is that right?
Yeah, there's just a lot of questions. A lot of times moms are in the trenches of painful breastfeeding, or they might have a really colicky baby, because tongue tie can lead to things like reflux or GI issues. And so, we're hormonal at that point, and we're just looking for the right answer on what to do for our baby. And just being able to kind of see all your options. You don't have to rush into a release, and working with a dentist who is very pro therapy to just bring that player onto the team, so that, even if you do have the release, you have that really good pre and post care. So there's a lot of providers in our town that I'm thankful for that support therapists, and those families just, I feel like, have the best outcome.
Are there ramifications to having a release procedure when it's not necessary?
Yeah, I would say I always look at function. So I think there is a lot, there's a lot that goes into tongue tie. Sometimes we just see the tie and we're like, oh, that's a tie that needs to be released. But that's not always the case. And so I think every baby deserves that functional assessment. because while the frenulum might be present, most people have a frenulum. What matters is the degree of how that mobility is affected or restricted. So if a baby can move their tongue and they're really functional and they're not having those other symptoms, mom can feed without pain. Maybe we don't need to rush in and release that. So I think it's tricky because there we do know that there can be long-term ramifications for not getting a tie released, but I think you should always make a decision in the moment for what those symptoms are in that moment, and always be looking at how functional is the tongue. So
Mhm. Mhm.
it's a hard decision for sure, and I walked that with my own kids, so I know how hard the decision can be. Yeah.
Yeah. So for those, frenulum's a big word. So for those who don't
Yeah.
know what a tongue tie is, maybe they haven't had that with their own kids, or they don't have kids. Can you just kind of explain what that is and then what those symptoms would be that we can look out for?
Yeah, so the frenulum, and I can show you on my own because I have a tongue tie, but so the frenulum is that piece of tissue under the tongue. We have one on our lip. Sometimes we have frenulums, or ties, quote unquote, in the buccal area, which means the cheek. And so basically, frenulum is just the name of the anatomy. That's the name of the tissue. What matters if we are tied or tongue tied or lip tied or buccal tied is how thick and fibrous is that tissue. How flexible is it? Can it move? Or is it truly restricting the mobility of the neck? Is it restricting the function of the tongue and the cheeks? And all of those, if there were a big mobility deficit, you're going to see symptoms in breastfeeding, difficulty feeding, maybe the reflux, body tension. All of those things can truly be related to a tongue tie that is very restricted and would benefit from that release.
So you can start treatment pretty quickly. Then how old are we talking? Like days
Yeah,
old?
so yes, days old. A lot of times you're gonna know kind of in the hospital how things are going, or at home if you've done a home birth. But those early days of breastfeeding, obviously, it's a learning curve for mom and baby. But if symptoms of pain are present that persist beyond, maybe the first 4 to 5 days of breastfeeding, if you're having that really painful latch, or if the baby's like leaking milk, or just struggling with some of those symptoms like reflux. Yeah, I mean, I've worked with babies as early as like a week old, all the way up to 6, 9 months, sometimes a year old. But the earlier you can intervene, the better the outcome. So that
Mm-hmm.
if that baby did need a release procedure done, um, you can get breastfeeding or bottle feeding off to a really good start.
Mm-hmm.
Yeah.
Yeah. So tell us a little bit more about you are doing all of this in the comfort of the patient's home. That's correct. It's all you are going to
Correct.
them.
So yeah, I can kind of back up a little bit. When I first started Hatch, I was 100% a mobile therapist. So going into the patient's home is where our sessions took place, which I love it. It's a natural environment. We can see whether we're working on nursing or whether it's a child's we're working on milestones. We're in that natural environment, and it's convenient. You don't have to change out of your pajamas if we're in that postpartum stage. So yes, I do in-home visits. But then recently this fall, I do also have a clinic space, which has allowed me to expand my reach a little bit. Right now, I serve a 25-minute radius around the Des Moines area. So if I have a client that lives further than that, they can come and see me in the clinic. And I do take some insurance visits in the clinic too. So that's just kind of helped increase my access a bit.
Yeah. Yeah. Where is that new location at?
Yeah, so it's in West Des Moines. It's within a place called the Kith and Kin Health Collaborative. So it's a really great space. I share it each of us have our own room. There's a lactation consultant and midwife. So that's great to collaborate. We actually host a monthly support group together, just for some community outreach and connection with the community. And then there's another physical therapist and a massage therapist. So we're all kind of under the same roof in West Des Moines. Yeah.
Okay. So what's been the biggest difference you've seen now that you have seen the mobile clinic physical therapy versus now that you're in a clinic, it sounds like you're with a lot of great providers that are seeing
Yeah.
similar patients. What's the biggest benefit to being in a clinic, and maybe what are some things that you still really value about being in the patient's home that you still are
Yeah.
wanting to do some home visits at times?
Yeah, I think there's benefits to both. And I think just having the options, because some people maybe don't want a home visit, or they may get stressed that their home has to be clean, or other kids have to be out of the house, or maybe I'm working with a mom that really just values her personal time and getting out to her PTs like me time. So I love going into the home. I think there's so much benefit for that. And I think I will always continue to have this hybrid practice where I do offer both. But just having that clinic space, like I said, to serve people that are outside my radius. I used to have people come to my house if they lived outside of that radius. And I just think it helps everybody just to have that common space. And it helps me feel like I'm a bit more of a community within the health collaborative. I love being next door to Emily. She's the owner of Blossom Optimal Health, which is her midwife and lactation business. So it's just been really great to be able to collaborate.
Yeah. And especially for moms, it is such a vulnerable time.
Yeah.
Um, you're super hormonal, you just had a baby, you're trusting somebody else with your baby. And then yeah, if you have other kids running around, it can be chaos and stressful. What's
Yeah.
been the biggest or the most rewarding thing about working with postpartum moms specifically, or challenge, either one?
Gosh, yeah, I think and I would say being able to go into somebody's home. I think in those early postpartum stages, most women just really appreciate the home visit side of things, where I come to you. You don't have to bundle up your baby and get them out of the house. We have so many fabulous pelvic health therapists in Des Moines. And I'm friends with many of them. And where I like to specialize in is in that perinatal stage. So pregnancy, and then maybe like postpartum stages, within that first year. So that's really where I love to specialize. And because I'm an infant therapist as well, we can address any infant concerns at the same time. So just it's been a really special bond. I've worked with a lot of mom and baby dyads. So maybe we treat the mom for her pelvic health concerns, but we also have concerns about torticollis, which is neck tightening, or maybe it's head flattening. Then we can also address any concerns for the infant in that same time frame. And you don't have to go to two separate appointments. So it's pretty great.
So they're combined, it's one appointment. It's not like back-to-back appointments. You're kind of doing things
Kind
together.
of, yeah, kind of all in one. If I'm billing insurance, it's a bit different. Obviously, we're two separate patients, but yeah, we can be treated within that same hour session. Yeah.
Mhm. So what
Yeah.
insurance then do you carry?
Yeah. So right now I'm credentialed with Blue Cross Blue Shield.
Awesome. Okay. Yeah. And especially with their pelvic floor is growing, but I feel like pediatric physical therapy, you are the only one in Des Moines that I know who specifically works with kiddos with that. Do you also work with men as well?
So that is one area that I do not specialize in.
Okay.
I'm always upfront about that. We have other wonderfully talented therapists that love seeing men. And so, if I ever have somebody that reaches out and I'm not the right fit for them, I love giving trusted referrals to other therapists in the area that do treat that population.
Yeah. Yeah. So
Yeah.
then practically, how do people find you? So I know you because I'm a physical therapist and I'm in this world, but how are people getting referred to you by their doctors or what does that look like?
So I have a few doctors that will do direct referrals. Most of them are pediatric dentists in the tethered oral tissue tongue tie world. And then a handful of pediatric clinics will refer patients, but a lot of it is word of mouth. I have an Instagram page, my website. On my website, there's like an online inquiry box, so you can fill that out if you're in need of services. And I typically respond within a business day or two. And right now, I do not have a wait list per se. So I can typically fit you in within about a week, maybe to 10-day period.
Mm-hmm. Mm-hmm. So then now that you're in network with insurance, you can see people maybe a little bit more frequently because
Yeah.
they're not paying all out of pocket. So in general, I know it depends on the diagnosis, but for like a tongue tie specifically, how often do you want to see that baby?
Yeah, for tongue tie, it really depends. If a family is seeking that really good pre and post procedure therapy, I might work with the baby maybe 2 times, maybe 3 times before the release procedure. And then after, it really just depends on their function and if we're dealing with other things like torticollis or body tension. But typically anywhere between like maybe 3 to 6 post procedure visits. So, but every baby is going to be different in what they how they present. But
Mhm.
that's I would say pretty typical.
So you're able when further medical intervention is necessary, it sounds like you're giving parents um, guidance pretty quickly, whether that's necessary or not, so that people are just getting answers
Yeah.
fast. Yeah.
Yeah, and it is kind of time sensitive. So, if you are on the fence about a release, we want to. I feel like the best outcomes happen when a baby's younger than 4 months, maybe 6 months old. Anything beyond that becomes more challenging to treat. So the best outcomes are the ones that are happening early.
Mhm.
But yeah,
So we can help you and your patients by just raising awareness that one, this kind of physical therapy exists so that
yep.
parents know where to go and when to go. Is there anything else that you would say would be helpful in spreading awareness on these different kinds of conditions or whatnot?
Yeah, I think for tongue tie specifically, just knowing that you don't have to rush into a procedure. A lot of times you go in and that procedure might be done the exact same day, and just know that you don't have to approach it like that. You can do the pre work that will set your baby up for better success. And then, really, at the very least, if you didn't know about therapy and your child has already had the tongue tie release done, knowing that therapy exists afterwards, and that's really going to give you the best outcome. So
Mm-hmm.
you're addressing the whole picture and not just that tiny little tie.
Mm-hmm. Just looking at the body as a whole.
Yeah. And then for
Yeah.
the other fields that I work in, obviously the pediatric pelvic health, just raising awareness that therapy for those types of conditions exists. A lot of parents don't know, and they're just again in the trenches of pee and poop accidents or difficulty potty training, and that is not something that any parent wants to go through for a prolonged period of time. So
Mm-hmm.
just knowing that help exists for those conditions as well.
Mm-hmm. So this is a selfish question, but we almost have a 2-year-old. What is
Uh-huh.
the price on I know every kid is different, is what they'll tell you, but when are some good ages or good signs that potty training is the next step, or what are ramifications of trying too early?
Yeah, so there's a lot of different approaches you can take. It's kind of I'm on the side where I want to take an approach that best fits that family dynamic. So not every approach is going to be the right approach for every family. But as far as the age, there definitely is a window of time that's appropriate. And that's generally anywhere between, I would say like 20 months at the earliest, all the way up to age 3 at the latest. That's kind of your sweet spot, and you look for your child's signs of readiness, which would be they have regular bowel movements, they're pooping once a day, it's soft, we're not scared to poop. Um, Waking up dry with a dry diaper from naps can be another indicator that maybe our bladder's ready to hold a bit longer, not through the night, but those nap times. If we're waking up dry, that can be a sign. And then being able to verbalize whether that's, or communicate, I should say, whether that's non-verbally or verbally, that you're showing signs that your child knows when they have to use the bathroom. And then what also helps is gross motor skills. Can we climb up onto a ladder to go potty, or can we at least help pull our pants down to go potty? So normally those skills are developing anywhere between 20 months to age 3. So just signs to look out for, and then your own parental readiness is important too.
Sure. So it shouldn't be a max assist every time you're trying to get your child to sit on the toilet, is what you're
Right,
saying.
and sometimes it is, it's going to be to start, but just encouraging your child to help with it a little bit.
Yeah.
Yeah.
Yeah. Well, very cool. Well, is there anything else about Hatch that any updates coming up that you would love to share? We're super thankful that you were willing to come on and to share
Yeah, of
your
course.
knowledge. And now we know a little bit more about your process and how we can send patients your way. It sounds pretty simple. I don't think a referral is required. Is that correct?
Nope, you don't need a doctor's referral. Nope. Sometimes if you want to keep your doctor in the loop, it's helpful, but
Yeah,
yeah, we're a direct access state, so you can get PT without a referral.
perfect.
But yeah, as far as upcoming events, really our support group that I host with Emily once a month, just keeping an eye out for those and spreading the word. It's a free group. It's a great way to build community with other moms in the area, and it's appropriate for really, I mean, birth all the way up to pre-walking, I would say, birth to crawling would be appropriate. And we address anything from breastfeeding concerns, bottle feeding concerns, gross motor development. And it just is a fun play session and a way to interact with other moms. So we
Sure.
host that once a month.
Do you have to sign up in advance or where is that at your clinic?
Yep, it's hosted at our clinic at the Kith and Kin Health Collaborative. Usually it's about the first Monday of every month, but just keep an eye on social media because that may not always be the case. But yeah, no need to sign up. You just show up, and yeah, it's about an
Awesome.
hour.
And it's for mom and baby.
Mom and baby. Yep.
Okay, well that's super helpful. And you have 2 kiddos at home, is that right? Do you bring your
Yeah,
kiddos to those events or no? Is that
I
a
don't.
time?
No, just that way I can be fully present. I do a lot of like one-on-one help with, so far we've had a lot of moms come in that have had some gross motor concerns with their kiddos. So I like to do some hands-on work with them if the mom's comfortable with that. So
Yeah,
having my own kids there would probably not go very well.
yeah, yeah, you're in
Yeah,
therapist mode at that point.
yeah, exactly.
All right. Well, thanks so much again. It's super fun to get to know more about you and your practice. And
Yeah.
we are in the baby stage over here at my house, so we know who to call when we
Yeah.
need something. So thanks
So
again.
excited.